Well, good morning, and welcome to another episode of Issues That Matter. And we have a very special guest today. And I can tell you that this special guest is one that I've come to respect a great deal. She's an advocate for the National Multiple Sclerosis Society, and she's a fabulous organizer. And if there's one thing I need, is an organizer. She serves as the co-chair of the Government Relations Committee of the National Multiple Sclerosis Society of Maine, and I'm proud to say that I am the other co-chair. And she has added a great deal of abilities to what we offer and what we can do. So Robin STIENWARD, welcome.
Good morning, Bob. How are you?
I'm very good. Thank you very much. So let's start off with a wide open question.
Uh-oh.
How would you define advocacy?
Advocacy, I think, is stepping up and talking out for what is important to you, making a difference, making sure that your point of view and the reasons behind it are heard.
Okay. What do you see as the advantages to the organization, and what do you see as the advantages to the individual?
Well, I'll speak from the perspective of multiple sclerosis, and I think right now we are going through in our country massive changes and conversations about health care. If those changes and conversations are happening without taking into consideration the lives of the 300,000 plus people with MS, then we could be left out in the cold. And there are some real issues for people with MS. Access to care, how open and transparent the systems of care and insurance are. All of those things have a different meaning for people who live with a chronic condition than they do for the general public. So unless we make our voices heard, those changes could happen without taking into consideration the needs of someone living with a chronic condition.
Now, when I think about advocacy, I look at it as a win-win-win situation. The individual wins because and I can speak from my own experience on this. When I went out on disability and I was no longer a sales manager, when I considered that sales management was what I did, I spent more time on my job than I did with my family. And all of a sudden, one day, I'm no longer a sales manager. What do I do?
Right.
Unfortunately, it took me a little while to get my gears running in the volunteer area. But since I have, it's been incredible. I've had opportunities open up for me that I'd never dreamed of. I've met people such as yourself that I've been blessed to meet and have the opportunity to work with and learn from. And it's all because I got involved.
Right.
I did not turn into a couch potato.
And the MS community is really an interesting community, too. There's a lot of support out there. Though people can be, by the disabilities that it might create, can be isolated, people who get out, who get involved, it's a wonderful, almost a fraternity of people. Everyone is very supportive. The MS Society itself runs support groups. People hear from each other. And it's exciting to be able to find an issue that's impacting a group of people who can't necessarily get out and speak for themselves, and to be able to help put that into words. And
I've had the opportunity to meet people that I would consider to be very inspirational.
Mm-hmm.
And I often say, if I'm addressing a group of people, don't look at me as the face of MS, because the way it's impacting me is nothing compared to the way it impacts so many other people that have it.
And you and I, we've talked about that, have been very fortunate in that we've been able to keep the disease somewhat at bay. The impacts are different. They're maybe not as visible, but we certainly know people, particularly those with primary progressive MS, who have been very seriously impacted, many of them from a really young age. And it is a blessing to be able to be a mouthpiece for issues that really matter to them.
And it's a blessing to be able to say, you might say a little bit in advance of what people might consider public knowledge, internationally as well as nationally, there was a heavy focus now on the more progressive forms of MS, such as primary progressive, secondary progressive, where from onset to varying degrees of disability, a significant disability, not like what I have. There's a increased research and commitment to finding ways to positively impact it, and eventually, as is the case for the relapsing remitting, eventually wiping it out, finding a cure.
And now more than ever, because there is so much focus on research and on finding cures, finding treatments, I think that it's a really important time to be speaking to our political representatives, the people who make policy decisions, and help them understand what those research dollars mean to us. Every pot of money is on the table right now. So the more we can speak up and help people, one, help them to see that of the money that's spent on research, volunteer-raised donations fund an enormous chunk of that. I think that's an area where we are somewhat ahead of the pack. The MS Society puts in 50% of the full amount of what the NIH spends in research for MS. And those are volunteer-raised donations. So if we can get involved and help our legislators understand the importance of maintaining that federal funding for research and what that means to us, I think that's just an amazing contribution.
Now, when you first started to get involved with advocacy, I know when I started, I had some doubts. What might have been your doubts?
Well, I was very quiet when I was first diagnosed. I was diagnosed in 2000 and didn't tell too many people, even my closest friends, because there was a lot of misunderstanding. I realize now, looking back, that the misunderstandings of what MS is and maybe the lack of information is because a lot of people like me don't speak up right away. So I was quiet. I didn't know if I really had anything to offer because I didn't have the experience that many people have of a lengthy time to diagnosis and serious disability. But I did learn that there were issues that hit all of us when my health plan instituted a tiered pricing for specialty drugs. And as you know, the drugs, the disease-modifying treatments for MS that have only been around since the early 1990s are very expensive. And they have been increasingly placed into tiers of pricing that can cost patients upwards of $1,000 a month. This is an issue that we're pushing back on. And when I found out, my health plan had not given me any previous notice. I went in one day to fill my prescription, and my copay went from $30 to $350, and I can't explain the shock I felt. But more than that, I felt betrayed by this health plan that I felt had been taking care of me for all these years. And I got mad. Talked to the MS Society, and at that point, they were putting together a news article on tiered pricing of drugs, something I learned a lot about very quickly. And they asked me, would I be willing to tell my story? And it was then that I realized that all of our stories, no matter how small it may seem at the time, are important in advancing an understanding of what the issues are that we deal with as patients.
Now, I can add to that, and I'm sure Robin remembers this, because she was a major advocate for it and a major part of our success. We in the state of Maine did get a law passed, managed to get a law passed that limited the amount that drug companies, pharmaceutical companies could increase. Why don't you speak to that a little bit?
Well, what happened was health plans, insurance plans, in my case it was an HMO, were increasingly pushing back against the high cost of these drugs by instituting tiered pricing, charging usually around 30% out of pocket to the patient. And what they were doing was balancing these increasing healthcare costs on the backs of a more limited number of people with chronic conditions. And that included cancer, rheumatoid arthritis, MS. These are all diseases with very expensive medications, but that are given to people representing a very small percentage of the population. And in my case, my health plan had increased tremendously the cost of the drug for MS. At the same time, they took drugs for blood pressure that probably, I don't know what percentage of their total patient population was on, and they lowered those by $3 a prescription. And it seemed to me that they were balancing their books in a very inequitable way. I see insurance as being a way of evening out the costs of disease. Certainly none of us asked to get MS. Spreading those costs a little bit better. As a result of the newspaper article, and it was a very well-written article that covered a number of people's stories, my health plan came back right before the article appeared, and they retracted their institution of the specialty drug tiering. Gave us back our money that we had paid over the last several months. And that health plan to date has not gone to tiered pricing again. So we did have an impact. When I moved up here to Maine 4 years ago, we were looking at the same issue. Tiered pricing was just beginning to creep into health plans in the state of Maine. And we had an advocate who was also someone living with MS in the legislature who brought forward a bill that would limit the out-of-pocket cost to patients for medications. We were able to get that through. What I would say too is that day I think we both learned what a big impact the testimony of people actually living with a condition can have. It wasn't just people with MS, it was families dealing with hemophilia, people with rheumatoid arthritis who gave testimony. And we have a citizens legislature here in Maine, and you could see on the faces of the legislators that they really took to heart what we had to say as individuals.
One of the things I want to point out is obviously you're hearing a lot of chatter about the MS involvement and involved with the MS Society. When we talk about advocacy, we can talk about advocacy in a broader sense. And to my way of thinking, which some people think is at times weird, but to my way of thinking, we are speaking to a wide audience. I know we're going to be talking a little bit later about LD 365, which is a bill that we're currently working on, that is going to give some tax advantage to people with disabilities for modifications to their home. But it's not limited to people with MS. Anybody with a disability will be able to take advantage of that bill, of the laws and what it's going to be able to do. So it doesn't really make much of a difference whether you advocate for MS or whether you advocate for cancer or lung disease or any one of a number. If you advocate for one, you are, in a very real sense, advocating for all.
Absolutely.
Because none of the disease or the challenges that people face, it's not limited to just that. What we managed to get passed back a few years ago was not limited to just people with MS.
Well, and I found that that's actually a really important point to keep in mind when you advocate. The legislators are hearing from people every day, from all sides. It's really important to understand that they have to deal with, in the state of Maine, 1.3 million people. Maybe 3,000 or possibly a little bit higher of those people have MS. But the things that we do for people with MS impact a bigger proportion of the population. We need to help them understand that. We need to help legislators understand why what we see as important will impact a bigger proportion of the population. In the case of LD 365, where we're looking at a tax credit for people who make modifications to their home to make it accessible, that will impact an entire elderly population in the state of Maine. That's a significant number of people. People who, at some point in their life, may need accessibility modifications to be able to stay in their home. It doesn't just impact people with MS.
And the payback to the state is that it costs a lot less money for a person to stay in their home and get treatment than it does to go the way
To be institutionalized.
to be institutionalized. Thank you for,
or just the cost of falls. When someone on main care falls in their home because they have, and this can be a simple thing, you've got a ledge between rooms, a threshold that you trip on, or stairs that you have to navigate with very poor balance, and that can happen to people with a number of different conditions or due to older age. You fall, you end up in the emergency room, you need rehabilitation, you're not able to get to work. All of these things have costs. So if we can, as advocates, see how what's good for us can be viewed by what's good. You mentioned it's good for me, it's good for the bigger group, it's good for the community. If we can help to express the dollar and cents terms, that helps. I think that everybody knows that the legislators need to be good stewards of our money. This makes sense for everybody. Keeping people in their homes, spending a little bit of money on a tax credit to allow people to make modifications to their home can save the state thousands of dollars for each person in costs of falls, in costs of early institutionalization, and we all know it's certainly better for everyone to be able to live in their home in a community that they're familiar with than to have to be institutionalized.
Yep.
So as an advocate, it's important for us to see what's good for me, but to express it as why this is good for my community and for my state. And I think just being sympathetic to the burdens that our legislators deal with as well, and helping them make that argument to the people who control the purse strings.
And we're getting a flavor of that currently with our efforts for the LD 365, and it's an experience. It's one of those things that had I not been involved in the advocacy for the MS Society, I would have never had the opportunity to have that experience and to get that view of the operations of government.
And it's easy to be cynical, to say nothing works, government's a mess. But when you get involved and you meet with people and you talk to them face to face, I found that that helps to knock down a little bit of my cynicism. It makes me feel a little more positive. And we work with people, you and I have talked about it, on both sides of the aisle and everywhere in between. MS certainly doesn't play politics. And we found people are welcoming of our input on every side of the aisle. And I really appreciate that.
Yep, I agree. In your experience, what type of advocacy activity gets you the most charged up?
Well, I think that will be different with each person. For me, it is making those connections. I have, my professional background is in public health. So for me, working with access to care issues, making sure that people who can't get out of their homes have access to health care, or finding ways for the health system in a more cost-effective way to meet the needs of people like those people living with MS, that gets me very excited. Being able to talk policy with people who are in positions to make policy, and to really make sure that they understand the perspective of people they may not have thought about as they're looking at policies. That gets me very excited. But there are certainly lots of other ways to be involved in advocacy. And I would encourage anybody who feels that our government has gotten too big and government needs to be local to pick up the phone and get to know your local legislator, so that when somebody asks them, do you know somebody living with MS? They can say, yes, I do. And you can feel that you've helped them to understand the issues that you deal with. That, to me, is the most basic. If we want our elected officials to be more responsive to our needs, they need to know who we are and what we deal with. We can't let them have this image of MS that may be 5 decades old. We really need to help them understand what John Doe living in Newport, Maine, is doing and how MS affects him. So I would encourage that. That, to me, is the first piece of advocacy. But advocacy can also be getting out in your community, going to a walk, to an MS walk, and making sure that people who are there understand what the issues are and know how they can talk to people about those issues.
Speaking of the MS Walk,
yes,
we have the MS Walk coming up on April 18th.
And April 19th in
And
Augusta.
April 19th up a little bit further north.
Yes, and I would encourage people to get involved with that. Go to the walk. If you haven't signed up, you can sign up online, and you have a website for that.
Yep.
If you haven't signed up, you can sign up to walk. You can donate to someone who's walking. I would encourage that. Or just go online to MS Society.
Volunteer.
And volunteer. Go onto the MS Society and find out what some of the issues are.
And thinking back to my experiences, that was my first venture into volunteering with the MS Society. I volunteered to sit behind a desk and register people on the day of the walk, and it just took off from there. And it's opened doors of opportunity that I would have never dreamed of doing, such as having this cablecast show. Doing something like this was never, ever on my radar screen. Now, there are some, I'm sure, that would say he probably should have kept it off his radar screen, but nevertheless, I'm here, I'm loving it. I have no intention of leaving it anytime soon.
But talking about issues that matter, you've opened a door for advocacy for lots of people from lots of different perspectives, and I think that's a huge contribution.
And the other part of it is that I want to point out is, and this is more to people who are involved in advocacy with other organizations, as well as people who are involved with advocacy with the MS Society, is you're not in it alone. And being the fact that there are advocates for a lot of other very worthwhile causes out there, it's better if we stay in communication and stay in contact with each other, because we do have a singular goal, and that is to help people that have a challenge in front of them. And I use the word challenge vehemently because I don't like the word disease. I hear the word disease, and I think, can't beat it. It's a disease. You just got to make the best of it. No, it's a challenge. I have a competitive spirit.
Hear, hear.
And as long as I keep that competitive spirit going, I have a purpose in life. And this gives me a great way to serve that purpose.
I think you're right. I think advocacy brings that out too. It really energizes you and makes you feel as though I can tackle this by putting words, a description to a challenge. You really are you've already taken the first step. Defining what those issues are and believing that there is something that can be done to confront some of those struggles. Like I said, being able to put a ramp in so that you can get in and out of your house and get to work is a major issue. Fighting for a tax credit that would make it easier, ease some of the burden on Maine taxpayers to be able to do that and take that first step is what we're trying to do with our advocacy.
Yep.
And you mentioned partnering. There are lots of groups out there. We have found a very good ally on this tax credit, home modification tax credit bill. We found a very good ally in the AARP of Maine and in Alpha One, an organization that helps many individuals live with the daily challenges of disability. So we're very happy to be working together with those groups. As I said, we worked with the Hemophilia Association and the American Cancer Society when we were working on the issue of overall treatment caps. There are always partnerships to be made. There are lots of people who can gain strength from working together. And I think that the MS Society has been particularly good at that.
What impact do you see of a person who makes that plunge, gets involved with advocacy? What impact does it have on that individual?
I've often thought that when you vocalize, when you put words to your thoughts, like I said, you've taken the first step. You've given yourself the courage to accept the challenge. You get involved with advocacy. You do meet people who are fighting a similar fight. So you have formed allegiances. You've found allies to help you with that challenge. You meet people that you thought didn't care and find out that they do care and that they will listen. And maybe they can't solve the problems, but they're willing to work with you. That can't help but be a positive impact. I just think that it's really important to be able to tell your story, to be able to put words to what you want to attack, what you want to challenge, and move that forward. And you won't be alone in doing that.
Excellent. And let's see, I'll try and push the MS fog out of my head. But we have the LD 365 that we're working on, and Archie, Representative Verot, has a couple of other bills.
There are two bills that have been working their way through the Taxation Committee. One is LD 48 and the other is LD 49. These bills would give, as I understand it, and I'm not fully versed on these, but they would give an excise tax credit for both for-hire vehicles and personal vehicles that have been upgraded so that they are accessible.
Modified.
Modified.
So that they are accessible.
And just to keep in mind, if you are a person using a wheelchair and need to have a wheelchair accessible van, that can add many thousands of dollars to the value of a vehicle. It's already a huge stretch to be able to purchase that vehicle or to purchase those modifications. To have to pay the excise tax on that much more highly valued vehicle on top of having to deal with the wheelchair use, the need to be able to get around, the more expensive vehicle, it's just another burden. And so Representative Verot from Brewer has proposed excise tax credits that would be allowed for people paying the taxes on those vehicles, the registration.
And all of these things are steps to help people improve the quality of their own lives.
Yes.
And they're not handouts.
Right.
You can say that they're help-ups, giving people a little bit of help to be able to better afford making some of these critical changes to their lifestyle to accommodate the challenges that they face. And I think it's incredibly important for people to take advantage of and to be involved in trying to make these things come about. So if you have a few minutes on your hands at any time and you want to make a phone call, give your local legislator a call and tell them to look into these things and offer their support where they can.
I know this is a big year for people to think about budget and money, and it sometimes sounds as though everything we're trying to do has a financial impact. One issue we've been involved in, and the National MS Society is looking into more, is telemedicine. We did get involved last year when there was a bill to allow the use of telemedicine, and that's providing health care using electronic means as opposed to a face-to-face visit. There was a bill to allow Maine Care to cover the cost of telemedicine when the cost for a similar service in face-to-face would be paid for. And this has some implications. There's no fiscal impact to the state, except perhaps some savings in that they don't have to transport people. If you are a person living with MS or someone else who is, for reasons maybe completely unrelated to your health, very isolated, someone living in way up north in the county, your need for medical services that may be 3 or 4 hours away can be a real burden.
Yep.
By using the current technology to be able to have some of the health care, whether it's a follow-up appointment or the monitoring of cardiac patients in their homes using telemedicine technology to monitor them on a daily basis, being able to do that so that the patient can be seen and treated very close to their home instead of always having to either hire a taxi or have someone drive them 3 hours to a doctor, can be a huge burden off the patient. And Maine Care has seen that as important. And so we were able to participate last year on a panel of health professionals around the state, the Nurses Association, the Hospital Association, number of doctors and mental health professionals, on a panel to rewrite the rules for Maine Care for telemedicine, to allow for the use of telemedicine where it's been shown to be very cost effective in keeping people out of the hospital because they're more closely monitored in their homes. There's some really exciting things coming. We are hoping for more detail as that comes, but again, that's one area where we've been able to get involved to make sure that the MS condition is included in people's thinking about how this might impact healthcare.
Well, you've just created a dilemma for me.
Okay.
And
I like doing that.
I know you do. I know you do. But the dilemma is, and I'll use this. I'll turn the clock back a little bit. I fairly recently had to buy a new cell phone, and I walked into a store to look at cell phones, and the salesperson very astutely came approach me and asked me if I wanted to buy a smartphone. And my response was, no, I don't want a smartphone. I want a dumb phone.
Right.
Well, dumb phones cannot take advantage of the telemedicine, of the abilities to communicate that you need to do the telemedicine.
Actually, I've been looking at a number of studies that have used telephone technology for patients with MS to do rehabilitation programs in the home or depression and fatigue counseling, and they use plug-in phones, regular home wall phones with a unit that's connected to it. So the technology actually is taking advantage of a number of different things. It's coming, as I say, it's under development. I understand there's somebody in California who's developed an app for the smartphone where you put your thumbs on the smartphone and it reads your EKG and sends it to your cardiologist. There's a lot ahead on the health front, and we want to be a part of that.
Yeah, as long as I have somebody with me to explain it to me.
I'm with you. I don't have a smartphone either. So for now, I think you can safely say that you won't need it right now.
Well, I don't know. It's at times I think I can use any intelligence I can get. I'm a big believer in self-deprecation.
Yes, and you are far smarter than you give yourself credit for. So.
Well, thank you. Well, from all the things that we've talked about today, what would be, if you were to try and pick out one singular point that you want people to walk away with, what might that be?
What I've said to others, I was asked this question by our national office, and I said, what got me out of my shell, what encouraged me to move forward with advocacy was when somebody asked me to tell my story and made sure that I did. Once I told my story, I felt liberated. I felt ready to move ahead and connect the dots to other people's stories, to the rationale for making improvements in policy that would impact people with MS. And that's why I say, tell your story to your legislator, tell your story to your neighbors. That's advocacy. Help people understand. It's not focused on you. It's helping people understand a disease that can be very complex, that does pose a lot of challenges, that is far too prevalent. Maine has one of the highest rates of multiple sclerosis in the country.
Don't we bounce back and forth with Vermont on that?
And we're still trying to get numbers because we don't have exact numbers. There is a great deal of multiple sclerosis in our service veterans. So the VA at Togus has been doing a lot of work with telemedicine and MS, with veterans with MS. The more people understand the complexity of this challenging illness, the better, the closer we will come to being able to resolve.
And one of the things that I've mentioned in the past on the show was that it is a strong belief of mine that when they find a cure for MS, for Parkinson's disease, ALS, or not any number of different challenges that are out there, when they find a cure for one, a major step will have been taken to finding a cure for all of them, because somewhere deep inside these challenges there is a common link, and when we can find that link, a treasure trove of cures will be in the offing.
The neurodegenerative illnesses, absolutely.
So I would encourage people by all means to get involved, and it's very easy to say I don't have time. Well, this is one of those things that it would be very, very beneficial if you can find a way to make the time. If you don't have the confidence, get involved. They need people with all kinds of skills to get involved, and you'll be able to find something. And if you're someone that is able to work but might have had some difficulties, had to go out on disability, but now you're ready to get back into the job force, into the labor market, it's a great way to meet people, to build your resume, to prove that you can do things, to prove that you are driven to do things, even if you don't get paid for it. And that means a heck of a lot to a prospective employer.
Absolutely.
And so it really is a great way to help yourself while helping any number of other individuals in your community. And speaking for MS again, it's very easy to draw a distinction and say that everybody knows somebody that has MS. And when you broaden that umbrella to cover other challenges, it's almost a dead bank certainty that everybody knows somebody who's impacted by a challenging disease, potentially disabling disease, potentially life-threatening disease. Everybody knows somebody. Maybe in the family, maybe a friend, maybe a coworker. The web is wide. So I would strongly encourage people to get involved. There's more than enough volunteer opportunities out there. They're almost for the picking.
Oh, yes.
Find a cause that's important to you and make the time to get involved, and you will benefit from it. That's almost a lead pipe guarantee that you will benefit from it. Robin, I want to thank you very much.
Thank you, Bob.
For being on the show. I think we imparted some valuable information.
And thank you for being our advocacy rock. We appreciate that. You are a true rock in advocacy, and we appreciate that.
You're not talking about my stubbornness.
No.
we have a very good working relationship. We have different views on certain things, but as society in general should do, we respect each other's views. We see the value in the views, and we always walk away with a smile on our face. Absolutely. And a chuckle in our heart, with a commitment to keep on trying to find areas where we do agree. And we have, I would say that we have a lot more areas where we agree than we have areas that we disagree. Mm-hmm. So, Robin, thank you very much.
Thank you, Bob. Appreciate it.
And folks, I hope you enjoyed the show. I hope you took away some pearls of wisdom, in large measure from my guests, because you're not going to hear too many from me. Have a great week, and I will see you again next week. Until the next time, make sure you have a safe time, and along the way, have a good time. Have a great week. Bye-bye.